Hello. Today I'd like to give a brief discussion about obesity and the challenges and barriers that obese people face when attempting to obtain health care. Obesity is defined by the World Health Organization as abnormal or excessive fat accumulation that may impair health. The prevalence of obesity has risen significantly over the last 50 years and is now so widespread that many have claimed that there is an obesity epidemic. In 2016, the World Health Organization estimated that globally, over 1.9 billion adults were overweight, including more than 650 million adults with obesity. At this time, over 40% of adults aged 20 and older in the United States are obese. In North America and many Western societies, individuals who are obese are negatively stereotyped and face prejudice and unfair treatment in healthcare settings. As many as 40% of adults with obesity report experiencing weight stigma and/or discrimination, and prevalence rates increase when body mass index increases. At the root of this stigma are beliefs that people with obesity are personally to blame for their weight, that they are somehow lazy, unmotivated, lacking willpower and self-discipline, or are not compliant with treatment. A recent survey of medical professionals found that almost half had witnessed stigmatizing communication or behaviors by peers towards patients with obesity, including offensive comments, making fun of someone's appearance, and facial expressions of disgust or smirks. This aligns with reports of other research that has documented associations between higher patient BMI and lower physician respect and negative attitudes towards the patient. In addition, the obese population may face implicit bias when healthcare facilities don't have adequate size gowns, BP cuffs, or examination tables that can properly accommodate the obese population. Many studies show that healthcare providers overwhelmingly feel inadequate in treating obesity by either not having the time or specific training to properly address the problem. Low socioeconomic status increases risk for obesity due to lack of finances to purchase healthy foods, or, as is often the case in poor rural or urban areas, access to healthy food options is limited due to living in a food desert. Unfortunately, many obese people, often due to stigma, have poor self-esteem, making them less likely to seek treatment for obesity. Also, many obese individuals may have failed at losing weight in the past, reducing their perceived self-efficacy to try and lose weight in the future. Some medications, like GLP-1 agonists, work incredibly well at treating obesity, but may be cost prohibitive or not covered by insurance, place them out of reach of many obese people. Also, as mentioned earlier, it may be difficult to find a provider who is even knowledgeable in treating obesity. Providers can promote health by educating obese patients about macronutrients and healthier eating habits. If a patient has limited access to healthy foods, such as those who often consume fast food or rely on corner stores, providers can still educate patients on how to pick healthier options. Providers need to promote some kind of physical activity to address obese conditions when applicable. Physical inactivity is one of the drivers of obesity and one of the main reasons for the development of obesity's comorbid conditions. Physical activity can reduce the risk of a number of diseases, and some of the health benefits of exercise can even be observed immediately after a single session. Large amounts of time spent viewing screens, such as watching TV, playing video games, or using a mobile phone, are all recognized as risk factors for obesity. Providers need to educate patients that screen time is usually associated with being sedentary, so it should be limited when possible. Also, screen time too close to bed or while in bed can affect sleep patterns, which can also promote obesity. While poor physical health, poor diet, and lack of exercise are the main drivers of obesity, the effect of uncontrolled stress can be just as detrimental to someone's health and can promote obesity. While certain life stressors like bills, jobs, or relationship troubles may be unavoidable, providers can still try to educate patients on stress reduction techniques such as deep breathing or mindfulness meditation, or even possibly provide a referral to a therapist.